I just wanted to remind everyone that everything that I talk about here today, it's not medical advice. So if you have any kind of condition or you want to treat any kind of condition or get any sort of medical result, it's best to do that working with a licensed healthcare practitioner individually. So the things I'm talking about here today are more topics of interest, and yeah, they're based in medical information, but it's not medical advice. So anyway, welcome everyone. So I went out in the yard earlier today, and I found these chrysanthemums just kind of languishing in the grass. I didn't do a good job of spiking them this year, but for those of you who have chrysanthemums in your yard, if you haven't checked, apparently they started opening. Last week I had some chrysanthemum tea. I drank it for a few days after that, but I got tired of it, honestly. So I'm taking a little break from it. But one of you, actually a couple of people said that they went to Tiansung Trading Company. I think one person went, it was already closed, and the other person went and they were unable to locate it. I've had a number of experiences there where I will be saying the English name of the herb, saying what I think is the correct Mandarin pronunciation of the herb at length, and I just get head shakes and no, we don't have that. But when I actually write the characters down, all of a sudden they're like, oh, I'll be saying Juhua, Juhua, and they're like, oh, Juhua, Juhua. I'm like, that's exactly what I said. But and then of course they have it there. So somebody went. It's totally possible that they are out, because sometimes they're out of things. But more than likely they have it. And the trick will be to write this character here, this Ju. So I'm just going to show folks how to write it, just in case you want to get it. You just start with these three strokes on the top, which is the grass radical. And then it has one of these, something like this. And finally, this rice radical inside it there. So even if you were to Google chrysanthemum Chinese character, you'd probably find that. And they should have the loose leaf chrysanthemum. They should have bricks of the yellow chrysanthemum. And there are times when they have the wild chrysanthemum. And that's something I wanted to just kind of mention here today. Is there are three main types, I should say, of chrysanthemum that are used medicinally. The three main categories, I should say, and there are multiple kind of subspecies of the flower that have slightly different effects. So if you want to get into it, you can read up on the different types. But the three main types are the white chrysanthemum, Baijuhua, the yellow chrysanthemum, Huangjuhua, and the wild chrysanthemum, Yejuhua. So the white chrysanthemum is especially good for descending liver fire, and it's especially protective for the lungs. So when the liver fire begins to insult the metal of the lungs, the white chrysanthemum would be best taken at that time. The yellow chrysanthemum is better for kind of cooling the liver. Both the white and the yellow and the wild chrysanthemum, they all three of those rather enter the lung and liver meridians. But the yellow chrysanthemum is better known, better used for cooling and clearing heat from the liver. And then finally, Yejuhua, the wild chrysanthemum. This is the one that has the strongest antiviral effect. So it's the one that's best used for the type of inflammation that presents at the early stages of, say, influenza, a mild influenza, or a cold. So all three of these types of chrysanthemum were kind of lumped together, and they were described as early as the period between 206 BC and 200 AD in a book called the Shen Nong Ban Cao Jing. This is the Shen Nong Ban Cao Jing, which is the Shen means like divine or spiritual, Nong is like a farmer or agriculturist, someone who cultivates plants, grows them. But Nong can also mean a pastoralist. So sometimes this is translated as the divine farmer, and sometimes it's like the divine husbandmen's, like the sense of husbandry, like where someone raises sheep and cattle, but also grows plants and kind of knows how to work with, kind of knows how to marry nature and get it to do what it is they want it to do. So this is a shenno. And then bun cao. Bun is like the most fundamental or kind of crucial, most central. Here when you have a tree, and then you have this line here kind of indicating the root or the kind of central deep place in the tree. Cao is literally means grass, but in general it also means herb. So these are like the fundamental herbs, and then this character Jing means classic. So altogether, it's the divine farmer's essential herbs classic, and this is I think a pretty good translation of that work. This is written by Sabine Wilms. I've never actually worked with her in person, but the book that I translated, Dr. Liu Li Hong's book, Classical Chinese Medicine, I translated it, and then Henry Buchtel and Heiner Fruhoff kind of went through and edited it and made corrections to my translation where they saw fit. And I know Sabine Wilms also contributed to that translation. I believe that one of her contributions was kind of systematizing all of the names of the classics that were cited in Dr. Liu's books, and coming up with proper titles for chapters and books and things like that. So anyway, this is available on Amazon. I picked mine up, and in it there is a short passage on chrysanthemum, and I thought that would be a good place for us to start, because even though today's lecture is going to be looking at warmth disease and the role that chrysanthemum might play in the diagnostic and treatment of illness according to warmth disease theory. Warmth disease and pretty much everything that we do in Chinese medicine all harkens back to these very early classics. The Yellow Emperor's Classic, which was back, before even the Shenong Bancao Jing, and then books like this that were right around the turn of the first millennium there, right around the time, 206 BC to 220 or so AD. So in this section on the chrysanthemum, it writes, Yi Ming Jia Hua. So it's also referred to as Jia Hua. Jia means like nodes on a plant, where you have these sort of nodes on the stem, where leaves would come out. You also have a flower. So it has an alternate name, the one that we're familiar with, Juhua chrysanthemum, but Jiahua literally means kind of node flower. And I think that's interesting because this character, Jia, character here, Jia, which is the node of a plant. Without the grass radical, we have this character, Jia, which refers to the nodes in a larger sense. They could be the weather nodes, so the changes in the seasonal changes that happen over a period of time, or the four seasons themselves, the sijia. But it also refers to the joints of the body, and it can also refer to rhythm. And if you remember the lecture last week, I wrote out a line from chapter 8 of the Yellow Emperor's Classic that talked about the lung organ in specifically. And the function that emerges from the office of the lung organ is this zhejie, this controlling or managing of the jia, of the nodes, the kind of rhythms in the body. So I do think that that alternate name for chrysanthemum is telling there. And then it says that it 治风头, it treats wind in the head. So this fengtou, this notion of fengtou, if you've ever been out in, you might have even experienced this weekend with the kind of very strong cold winds that we had suddenly blowing after warm weather, where you can feel the wind kind of maybe entering the head or affecting the head in some way, and creating this sensation of fengtou, this kind of windy or almost like scattered sensation in the head. And then it goes on to define this further, or at least elaborate on the symptom picture that chrysanthemum would be pertinent for. It says, "Tou xuan zhong tong." The head is xuan, this character. Tou xuan zhong tong. Tou is head. This character xuan, we have here the character for the I, which was originally written, something like this. It's not too hard to imagine that being an I. And then this character here, xuan, which refers to something being indistinct or vague, kind of mysterious. This character here was originally written like this, something like that. And sometimes it would even have these three lines at the bottom. And it referred to the silkworm's cocoon. So these very fine kind of threads that that you could unravel and create the kind of the long silk thread that could be used in sericulture and the production of silk goods, was this character here, this xuan. But it's often used to refer to things that are vague or indistinct. It can refer to kind of like a dizziness or a kind of a confusion. Oftentimes these mental pictures, these analogies that are created by bringing together individual kind of radicals that each have their own analogical gestalt. These analogies take on multiple forms. So for instance, it can mean like a blurriness or indistinctness of vision, but it can also be, this xuan can also be like a darkening of things, or like a mistiness of things. For instance, if you take the mountain radical, shan, and then you put two of these silk radicals into it, these kind of long threads going up into the mountains, you have yo, which is, it's referred to as like distant and mysterious, kind of hidden, way off in the distance. So if you can almost imagine like a long silk thread, kind of winding up into the mountains somewhere that you might never go, a kind of mysteriousness or something. But anyway, in terms of chrysanthemum, we're one of the symptoms that you might prescribe it for is this tou feng, this headwind, and this tou xuan zhong tong. Zhong tong is like swollen and painful. So it's a sensation that the head is kind of muddled and confused and dark, but there's also a feeling of swelling, like the kind of inflammation where the head feels as if, maybe it feels as if the brain is swelling slightly in the head. There's a feeling of pressure probably from that, and then pain from that. And then there's some other kind of idiosyncratic language in here. And then it goes on to say, mu yu tuole. The eyes almost feel as if that tears are being kind of pulled from them or torn from them. Literally it means that the eyes desire to like pull or remove tears. So there's a teariness of the eyes. Lei chu, tears are emerging. And then the next part is interesting because it says pi fu si ji, the skin looks a bit like dried or dead flesh. And we talked a bit about last week when we talked about some of the health-giving properties of chrysanthemum. One was that it had a lot of vitamin A in it, which of course helps with the keratinocytes maturing into epidermal cells. So we talked about the type of keratosis, the pilar keratosis that people sometimes get on the backs of their arms, where the it's almost as if the flesh on the back of the arm is dry and the individual hair follicles are rough. The vitamin A that you find in chrysanthemum could, help with that. And, there are other things, of course, in the chrysanthemum, the other antioxidants, the flavonoids and things like that, that could help to kind of enliven, I suppose, the skin and give you a healthier complexion. But here, something that's pathognomonic that indicates chrysanthemum might be prescribed is that sort of dead or withered look to the skin. And then besides these symptoms, it also says wu feng shi bi. There's like an aversion to wind, and then there's what's called shi bi, which is a dampness type of joint malady. So it would be a stiffness or pain in the joints that was due to dampness. Then it goes on to say jiu fu liu qi shui. If you take it for a long time, it will benefit the blood and the qi in the blood. So it talks about these kind of more acute symptoms that you might take chrysanthemum for, but it also reminds the reader that if you take it over a long period of time, if you just drink it every day or drink it regularly, it will benefit the qi in the blood. And it goes on to say, qing shan, it will actually lighten the body, it will make the body feel kind of lighter. And nai lao, it will stave off aging, so it will prevent aging. Yan yan, and it will extend the years. So there are two facets to chrysanthemum, and we talked about both these facets last week. There's the way that it can be used for kind of an acute symptom picture. Here it's talking a lot about these symptoms that relate to the eyes and to the head. And then there are the benefits that you would get from it from taking it over a long period of time, which we also talked about a little bit, which is essentially, benefiting the blood and the qi, and then giving the body a sense of lightness rather than a heaviness, a real lightness of the body, preventing aging. A lot of those antioxidant properties and whatnot to prevent aging, and extending the years. But I'm going to talk a bit about another biochemical constituent of chrysanthemum that relates not only to the way it can be used for acute disease, but also how it can help prevent the types of chronic disease and chronic inflammation that characterize aging. So I don't believe we talked about this too much last week. I may have mentioned it briefly, but there's a bioactive component, a biochemical component called yejuhua lactone. So this yejuhua, this is the wild chrysanthemum lactone. And it essentially interferes with the way the NF-κB molecule acts inside the cell. So I want to go over this real quick here for those of you who are interested or who want to kind of have it's one thing to sort of say, oh, well, chrysanthemum helps prevent helps to prevent inflammation. But if you don't really understand, or if you don't have a clear picture of what exactly it's doing in the body, it just kind of stays this sort of abstract thing. And it's also, I think, slightly more difficult to, to believe or to have confidence in. But essentially this Yeju lactone, which is also referred to as handolin, it interferes with the activation of this NFKB protein in the body. I'm gonna just kind of draw a couple things out here. So on the surface of all of our cells, we have this phospholipid bilayer. So on the surface of all of our cells, we have this kind of phospholipid bilayer. If you're not familiar with these terms, essentially our cell membranes are made up of these phosphate groups and then these long chain lipid groups. And the way it works is the phosphate groups will orient towards the aqueous environment of the outside of the cell and the inside of the cell. And then the lipid components, which are these long chains, they associate with one another. So we have kind of oil and water, so to speak. And that creates a cell membrane. Now the cell membrane itself, this phospholipid bilayer, has lots and lots of various proteins on its surface that act as gateways, and they also act as links in messenger chains from outside the cell to inside the cell. One thing that can be produced outside the cell in response to the presence of a virus, the presence of a bacteria, oxidative stress, so the types of reactive oxygen species that would cause oxidative damage. This could be anything from like, what could be produced by like exposure to, say, chlorine or something like that. One thing that's produced is this TNF alpha. TNF alpha is produced by the immune cells in the body when they detect one of these insults. It could be they detect a virus, they detect a bacteria, they detect something else. It could even be a dead tissue there, something that the body wants to clear and flush away. It will then produce this TNF alpha. The TNF alpha, I don't want to get too much into the nitty gritty of it, but essentially it binds outside the cell to the exterior of the cell. And then this inner region here of this cell membrane protein, this can cause one of two things to happen. When TNF alpha binds there, it can either send the cell towards apoptosis, which is the cell essentially committing suicide and dying, or it can send the cell towards inflammation. And in order for this inflammatory process to happen, another protein, this NFKB, will actually go into the nucleus and create a kind of, and tell the nucleus to start producing the proteins that will cause inflammation in the cell and outside the cell. So this is a helpful thing. For instance, in the case of influenza, there was a study that came out that showed that the presence of this TNF alpha, this tumor necrosis factor alpha, reduced the likelihood that person's influenza would become dangerous. So it generates inflammation, but it actually helps the body to clear away the virus, the pathogen. But in terms of long-term inflammation, so when we think about the aging process, one thing that occurs is the body tends to enter a state where there is a lot of just kind of chronic inflammation throughout the body. And this chronic inflammation, it causes not just the kind of pain and discomfort, the deterioration of our tissues and whatnot, but it can even cause the muscles in our body to wither and shrink over time. So by drinking chrysanthemum tea that has a lot of this handle in it, the body's able to kind of interrupt this inflammatory cascade, and over time it could, as it says in the Shanong Bansao Jing, it could stave off old age and extend the years in that sense. I should probably ask now if there are any questions on what I just went over. I'm trying to kind of present it in a summary way, but I'm worried that it might have been confusing for some of you. Does anyone have any questions about what I just went over? No? Okay, great. Well, I'd like then to kind of segue into talking about warmth disease. So this one here means warmth, and bing means disease. Warmth disease as a kind of separate school with its own kind of adherents and its own methods of diagnosing and treating disease arose fairly late, as a formal body, as a formal kind of study or school of thought. It arose fairly late in the development of Chinese medicine. So as early as the 14th century, there was discussion of the Shanghan Lun, of Zhang Zhongjing's book, the Shanghan Lun, because though he focuses on Shanghan, on cold damage, in paragraph 6 of that book, he mentions briefly a distinction between Shanghan, this cold damage, and Wenbing, and warmth disease. Now, he's referring back to, I believe he's referring back to a number of discussions of Shanghan and Wenbing in the Yellow Emperor's Classic, in the Simple Questions, and also the Ling Shu. And when you go back to the Yellow Emperor's Classic, you find both Shanghan and Wenbing and warmth disease or heat disease discussed, but they're not discussed in a very organized way. And there are times when the discussion seems kind of almost contradictory. There are places where the discussion seems to first say one thing and then say something else. So for instance, in chapter 31 of the Yellow Emperor's Classic, it says, 日病者, heat diseases. Here he uses the character 日, which means heat, but he says 日病者, heat diseases, 皆伤寒之类也. They are all of the category of Shanghan. So he comes right out and says, well, heat diseases, they just belong to the category of Shanghan, which would make, which would support, I think, a lot of the ideas that Dr. Liu Lihong puts forward, which is Shanghan really is damage to the cold. It's not cold damage. But elsewhere in the Yellow Emperor's Classic, it says, it distinguishes between Shanghan, cold damage, and heat disease by saying that Shanghan is characterized by a very strong aversion to cold or a sensation of cold. Even though one of its kind of primary features is fever, is actual heat, there is this notion that shanghan has something to do with, has more to do with some element of cold to it. In talking about heat disease, going back to chapter 31, it very much paints a picture of an acute viral illness. And maybe even, you might even think of this kind of heat disease as like an epidemic or a pandemic type of illness, because here's how he describes it. He says, 或输或死, whether the person recovers or whether they die. 气死皆以6、7日之间, their death will occur within 6 or 7 days. 气数皆以10日以上, their recovery will happen after 10 days. So when you think about the course of influenza, epidemic influenza, not necessarily pandemic influenza, but also when you read descriptions of the 8 cases of H5N1 influenza, the avian flu influenza, or H1N1 influenza, the course of illness was such that the person would grow very sick. And if they hadn't died by, 6, 7, or say 10 days, they would very often recover. But many of these people would die within that first week. So this picture of heat disease as like an acute infection of some sort, infectious process, goes all the way back to the description of heat disease in the Yellow Emperor's Classic, back here in chapter 31. So yeah, I could kind of go into that in more detail, but that was the Yellow Emperor's Classic, which is, back, 2,500 years ago. Then we had the Shanghan Lun, which was written, 600, 700, 800 years after that. And this book is more of a clinical guide to how to treat disease. But again, it focuses on cold damage. And Dr. Liu's take on it is you really don't need to go any further than Zhang Zhongjing's book to treat any sort of disease. So you can treat even what's classified as heat disease later on by understanding and applying the principles in Zhang Zhongjing's book. But in the 14th century, when you had these kind of very deadly, very virulent viral infections in the metropolitan populations of Southeast China, physicians and scholars started to take a second look at the Shanghan Lun, and they started to notice that some of the herbs that they were using to treat illness were more effective in treating these kind of sudden, intense viral illnesses that were characterized more by heat symptoms. So they noticed that bitter and cold herbs were better at treating these illnesses, whereas a lot of the herbs that were used in the Shanghan Lun to treat acute febrile illness were warm and sweet and pungent, like cinnamon twig, I think, is a classic example, or red date. They're warm and sweet herbs, and so they started to have better luck, better efficacy rather, treating illness using a lot of these bitter and cold herbs, and that caused them to revisit passages in the Shanghan Lun, but also to go back in some ways to the Yellow Emperor's Classic and to the Classic of Difficulties, the Nanjing, to kind of try to recreate or create a different model of the body. So in heat disease theory, rather than the 6 configurations, the Liuhe, the 6 configurations that you find in the Shanghan Lun, where you have the Taiyang, the Yangming, and the Shaoyang, and then you have the Taiyin, the Shaoyin and the Zhueyin, these 6 layers in the body. In heat disease theory, you have 2 different models. One model is the 4 levels of disease, and the other model is the triple burner model. And both of these models can be used together. So when they talk about the 4 levels of disease, they talk about first the surface level, the wei qi, which is the outside of the body. So this surface level in Wenbing theory is this wei. This wei level. This is an interesting character because in the center you have this. You have a square or something like that, some kind of center there. And then each of these other parts was a foot. So this part here was like an early depiction of a foot. And you can kind of make it out. Maybe these are the toes and this is the axis of the foot. So characters that have to do with feet or with stepping will have this character in them. So here you have this kind of center, this central structure or something there. And then you have these feet going around it, walking around it, kind of patrolling the perimeter. You know, you imagine if you had a walled city and you had your, you know, you had soldiers or patrols going around the outside, doing their marches and their kind of changing of the guard. That's this way. And it's described as this sort of defensive qi on the outside of the body. And so when you begin to suffer from, when the body is first invaded by a pathogen on the surface, the types of symptoms that you would get are fever, kind of a dry, non-productive cough, kind of a tickling, sort of bothersome cough. You'll have mild thirst and a headache. So that's at the very surface level. And if you think back to last week's lecture, and maybe just what you know about chrysanthemum in general, and also from what we saw in the Shenong Bancao Jing, you could see that chrysanthemum is well suited to this layer in the heat disease pattern. The fever, because it has the ability to induce sweating, and it has anti-inflammatory effects. The kind of dry cough, because of its affinity for the lungs, and its ability to sort of harmonize the liver and the lung. The liver is seen as causing the qi to rise, and the lung is seen as allowing the qi to descend. So with a cough, one of its key features in Chinese medicine understanding is the rising and descending properties of the qi are in disharmony, and there's more of a rising property. So rather than the lungs being able to descend easily, there's a this kind of cough of the qi coming up again. And then mild thirst. I think we talked a bit about how chrysanthemum has all these trace minerals in it, and other electrolytes and whatnot that can quench the thirst. But it too it's very nice to drink. And then you have a headache. And we talked about in the Shenong Bancao Jing how the features of it were this: the head was felt swollen and painful. So chrysanthemum would be best suited to that kind of wei level. But after this defensive level of the diagnosis, there are 3 other levels. So we have first the defensive. This is the defensive qi. And then you have the qi level, the blood level, or I'm sorry, the nutritive level. And lastly, the blood level. So it'd be 1, 2, 3, 4. These 4 layers. And in terms of the heat pathogen invading the body, these are also the kind of degree of severity. So at the level of the defensive qi, you have this kind of mild discomfort. It can happen very suddenly. As I mentioned last week, one of the differences between shanghan disease or diseases that are brought about by a cold pathogen, as it's described in Zhang Zhongjing's book, and what the physicians were noticing in as early as the 13th and 14th centuries in China. One of the main differences was the speed of onset. So you're, as I said before in the previous lecture, you're going along, everything's fine, and then all of a sudden, without any warning, you have a sore throat and you have a bit of a cough and your head is hurting. It's not like where sometimes when you get sick, when you get just kind of a cold, for instance, you could already feel run down, feel tired. You could just kind of tell that something's coming on, and then you get home and first your head feels a little funny, and then slowly it becomes a headache. Your throat feels a little dry and slowly it becomes painful. That kind of slower onset of hours would be less indicative of heat disease syndrome than what I just described, which would be like you're going along, everything's fine, you're drinking your coffee, and then the next thing you know, you have a sore throat before you can even finish your cup of coffee. So it happens in the course of minutes. But that's also here at this defensive qi level. After that, when it goes to the qi level, where you're getting more into the interior of the body, it's going from the exterior where you have the defensive qi kind of combating the pathogen. When it goes to the qi level, now you would have high fever, you'd have a lot of thirst, you would feel very uncomfortable. You'd be more than likely you'd be kind of prostrate. You need to kind of lie down and things like that. And then when it got to the yin level, to the nutritive level, you'd really see that the fluids in the body starting to dry up. So the person may even have an aversion to drinking water, but more than likely they would have fairly powerful thirst, and they would be, once it gets to the yin level, there would be disorientation. So there would be, a degree of kind of delirium. The individual would more than likely not be able to sleep with this type of fever. And they may also get, at the yin level, they may start to get, rashes and things. So things like measles or chicken pox, where you actually see the exanthem on the surface of the body. That would be in the heat disease school, that would be the pathogen actually entering the yin level, the nutritive level. And lastly, when it gets deep into the body, when it gets into the deepest sort of substance of the body, it's in the blood level, the shred level. And at that point, the person will start to have spasms, epistaxis, kind of bleeding from the nose. They may vomit or spit blood. So this is a very serious, very extreme type of presentation. If you think about a lot of the kind of infectious viral diseases that we're concerned about even today, it's not too hard to fit them somewhere in these patterns. So those of you who've had a really bad bout of the flu have probably gone through all 3 of these levels. With the defensive level, first you have a little bit of a cough, a sore throat, and then the next thing you know, you're feeling very hot and flush. You need to lie down, but you're still fairly cognizant and cogent. But then maybe later in the night, you actually, if you've been sick enough, you'll actually become delirious, and you'll be unable to sleep. You'll be disoriented. You'll be kind of like half awake, half asleep type thing. But this blood level is especially scary, right? Because there we start getting into a picture that sounds a lot like, say, Ebola or something like that, where you have just frank bleeding. The body is starting to extravasate blood. And this blood level does pertain to influenza, but not the run-of-the-mill seasonal influenza. Here we'd be talking about pandemic influenzas or a the kind of what's referred to as bird flu. So here I'm talking about the sort of strain that occurred in 1918 that killed so many people. There you saw the disease get into this blood level. When the people would die from this pandemic flu, it killed, you know, people estimate between 50 and 150 million people died from that pandemic back in 1918. When they died because their lungs filled with blood. So the epithelium, the thin layer of epithelium that separated the blood vessels in the lungs from the air passageways in the lungs would become so rapidly inflamed that blood would leak from those blood vessels into the pleural space, into the cavities in the lungs, and the lungs would fill up with blood, and the people that were suffering from it would turn a very dark, purplish, almost black color from lack of oxygen. And physicians often described those treating patients in the barracks in 1918. This was at the end of World War I, and many people point to it as one of the main causes for World War I ending. When they examine the patients, when they would look at them, they might not be able to tell what race they were because their skin was so darkened from the lack of oxygen. And when they would do an autopsy and open them up, the lungs would be so filled with blood that the lung tissue looked more like liver tissue than lung tissue. So rather than being, this kind of soft, friable, white tissue, it would be brown and full of coagulated blood. So that's where you're getting to this blood level. I think it's fascinating, or it's admirable, I should say, that by using the information that's in the Yellow Emperor's Classic, in the Huangdi Neijing, Chinese medical practitioners are able to take that information and they're able to adapt it to new families or new kind of presentations of illness. So the type of viral pandemics that occurred when you had these metropolitan centers in the southern Song and then into the Yuan and Ming dynasties, where there was a lot of international commerce, both from seafaring vessels and from the Silk Road. There was all of a sudden all these viral illnesses that were being moved around. Chinese medicine could adapt to a whole kind of new system of disease presentation that occurred there. And I do want to plug Dr. Liu's book real quickly. So I think it was just like 2 weeks ago or something like that, the New York Review, so the New York Times Review of Books, the New York Review did a whole article. Ian Johnson wrote an article on Dr. Liu's book. And he looked not only at Dr. Liu's book, Classical Chinese Medicine, but he focused on how Dr. Liu was able to use the information that he presented in classical Chinese medicine. It's all derived from the Yellow Emperor's Classic and the Shanghan Lun to treat and kind of successfully diagnose COVID cases. So he was able to go into these COVID wards in China and treat illness using this material that's in his book there. So once again, nothing in this lecture should be construed as information that you could use to treat any illness. That definitely includes COVID-19. But it's fascinating. If you go to my Instagram account, I have a little, I posted something about that review. But if you just Google New York Review of Books, Liu Li Hong, I'll just write his name on here. You can read a bit about that. really home. And those of you who aren't familiar with this book, it's definitely worth picking up a copy. If you want just an excellent introduction to the theory of Chinese medicine, but also how Chinese medicine has been taught and learned over the centuries, and sort of the challenges to Chinese medicine today, it's excellent. What's so great about it is it's written from a Chinese person's perspective in the Chinese milieu in China. So it gives you a real sense of the state of the medicine today. Gosh, I didn't get as far as I wanted to. I just want to quickly touch on the other method of diagnosis and categorization of disease in warmth disease theory, and that is the three burners theory. And I can go into more detail next lecture, but essentially in that theory, you have the upper burner, the middle burner, and then the lower burner. And so these heat pathogens that can go through these four stages I've just outlined can also affect the upper burner, which would be the lung and the pericardium. They can affect the middle burner, which would be the stomach and the large intestine. And they can affect the lower burner, which is kind of refers to the kidney and the liver primarily. So infectious diseases indeed can affect those different organs via different routes. So you can have, you can have a stomach flu, you can have an upper respiratory infection. You could also have something like, say, hepatitis or a kidney infection. And so those three burners were also discussed in terms of Chinese medicine, but the three burners also exist throughout the body. So every cell also has these kind of three burners in it, and the body's innate immune response to a pathogenic influence, a pathogenic factor, that's what you're seeing in heat disease. So very often this would, of course, be some sort of infectious disease, but it could also be, some other type of environmental factor there. But the point that I think that you're bringing out is, there are two different types of immune response. There's the humoral immunity, which is the kind of learned immune response that allows us to use antibodies to kind of dampen and sedate an illness. When we get a vaccination, the whole point is for our body to be able to create antibodies. So if we get sick, we don't get very sick. The body can kind of deal with it without these extreme symptoms. But when the body doesn't have that ability, say if it's a novel virus or a very aggressive virus, and it's not able to effectively deal with it in a short period of time with readily made antibodies or with B cell lines that are able to produce those antibodies on demand, then the innate immune response, this just kind of inflammatory response where you have heat, pain, swelling, the effusion of fluid, fever, that response is more prominent. So yes, that's precisely right. Thank you.